Thank you for the introduction. So yes, I'm Catherine Lawrence. I work as a medical advisor for Santhera UK, which for those of you who don't know is a pharmaceutical company. So I just wanted to take 5 minutes today to explain to you a little bit about the work that we've been doing and how we've been starting to explore pathways of care in rare eye diseases and how we've been interacting with patients and patient groups to try to understand a little bit more about that and how we as a pharmaceutical company can start to help in making progress in terms of diagnosis and routes to care. So just a little bit of an introduction. So ophthalmology is more commonly known as a very mainstream type of medicine, but increasingly rare disease is becoming part of their treatment pathways and part of their speciality. There are now a number of genes that have been identified that correlate to rare diseases that can affect various structures of the eye and cause visual loss in patients. The rare disease that I particularly want to talk about today is a disease called Lebers hereditary optic neuropathy, or much more easily pronounced as LON. It's a mitochondrial disease. It's very rare, it's very progressive, and patients very rapidly go on to experience very severe vision loss, leading in most cases to blindness. And in fact, those patients that become symptomatic within 1 year, over 90% of them experience visual loss in both eyes. Now, the prevalence, as with most rare diseases, is an estimate. In Europe, we think it's somewhere around 1 in 45,000. There have been 2 studies done in the north of the UK, which place it at around 1 in 31,000. So thinking about where we are now, if we look at Scotland, that's probably about 150 patients that have LON in Scotland. But what's most interesting is there's actually an incomplete penetrance. So of those patients that carry the genetic mutation, probably only about 50% of males will develop symptoms and about 15% of females. And there are varying reasons as to why that is, mostly down to environmental or lifestyle choices. So what we do know about the work that we've already done in LON is that the pathways of care are difficult. It's a similar story to other rare diseases and stories that we've already heard about today, that there are many routes that these patients can take into the healthcare system. Once they're in the healthcare system, there are many different touch points. And quite often this can lead to a significant delay in diagnosis or in some cases misdiagnosis. So what we did as a company was back in 2017, we actually held the first European LON patient advisory group to try to understand a little bit more about the patient advisory group's perspective on that route to diagnosis and the pathways that they were taking. We had to hold it on a European basis because it's such a rare disease that we needed to go to all countries to have enough people to pull together to create that consensus of opinion. And we managed to get together patient advisory groups from 7 different countries in Europe. During that advisory board, we carried out a questionnaire to understand a little bit more about the patient's thoughts. And the results of this questionnaire were actually presented at the European Neuro-Ophthalmology Society meeting in 2017. So I just wanted to focus on the answers to some of those questions in that questionnaire, specifically focusing on the patient's thoughts about their route to diagnosis and the pathways that they took. So I've just highlighted a couple of them here, because obviously I don't have time to go through the whole questionnaire results with you. Of particular interest was the first question, so this question up here, about how many healthcare professionals patients actually had to consult before a diagnosis. And you can see that the majority of the patients had consulted with 5 or more healthcare professionals before they'd reached a diagnosis, which probably leads into the answers to the question at the bottom, that when they were asked, do they think that professionals are sufficiently aware of LON, the majority said either no or certainly not all professionals. So I suspect those 2 answers are fairly well linked together. What was also interesting is when we gave them a list of potential alternative diagnoses, we asked the patients to list how many alternative diagnoses they'd been through. Although there is some variability in the answers, some patients didn't know, some hadn't been through that many, there was certainly a significant number of patients who had had a number of different potential diagnoses that they'd had to go through. Now, what's of interest to us, and we've actually held up now organising a second advisory board to find out is to understand that in a little bit more detail in terms of what that actually meant for the patient, what that meant in terms of timescales, clinic appointments, etc., how long they were actually in a system as a result of going through those different diagnoses. But what we do know at this point in time is that there certainly may not always be a clear referral pathway into services, but Santhera are keen to continue to work with patients. We've seen the benefit of being able to work with the patients and understand more about the disease, and we're keen to continue to collaborate. And we're starting to put into place some actions to help address some of these problems. And in fact, we held the very first European LON Forum meeting very recently, which was specifically for clinicians around Europe to try to educate the clinicians further about how to diagnose LON so that we can start to help to improve the route to diagnosis. Okay. Thank you.